Hi, I'm Dr. Akash Bajaj. Now today I'm going to talk to you about an epidural steroid injection, what it is, why we do it, and what to expect. So typically an epidural steroid injection is done to minimize any sort of inflammation around a nerve root. Now inflammation around a nerve root can cause pain of a very particular nature, not just pain, but numbness, tingling, pins and needles, and sometimes even weakness. The point of an epidural injection is to inject typically a steroid medication near the nerve root to minimize inflammation. And by doing that, we can decrease some of those symptoms mentioned. Now, typically the way this is done is you'll be taken to either an ambulatory surgical center, a hospital, or an office. You're typically face down during the procedure, at which point the target region is cleaned surgically and prepped in a sterile fashion using strict surgical technique. At this point, we use a live x-ray machine called a fluoroscopy machine. Now, this machine allows us to visualize in real time using live x-ray, specifically the nerve root in question. Once you're face down, you may or may not have the option of anesthesia or conscious sedation, so you can talk to your doctor more about that. If you are given conscious sedation at this point, the anesthesiologist will typically go and start that process and you'll be put into twilight sedation. And if you're not, then obviously you'll be awake. Using the live x-ray machine then, we anesthetize the skin and subcutaneous tissue, and at that point a small needle is inserted through the skin and directed and navigated specifically using the live x-ray to the target region. This keeps you safe and this keeps me accurate. At this point, once we confirm we're in the right place, we typically inject a contrast dye which lights up under the x-ray so we can further confirm we're in the right place. So we confirm with x-ray image guidance as well as contrast dye imaging. At that point, the medication is injected. The medication is typically a combination of a steroid and a local anesthetic, or a steroid and normal saline, which is in essence salt water. At this point, the procedure is done, and typically you'll be taken to the recovery room, or if done under local anesthesia, sometimes you are not taken to a recovery room and you're discharged. At this point, we wait for the benefits to kick in. Now, typically the benefits of the procedure can take 3 to 5 days to kick in, but I tell my patients to wait at least 7 days or 1 full week before we reassess. Sometimes you may need more than one of these injections, up to 3, just depending on how you do. So this is a conversation to be had with you and your doctor after typically the first injection to assess kind of where you're at, what the effect was, and what the appropriate game plan is. The theory behind doing up to 3 of these injections is the medication layers upon itself, so you get more of a cumulative effect, which can potentially last longer and decrease your pain more significantly. Now, there are some risks with the procedure, and this includes bleeding, infection, allergic reaction to medications, and potential nerve damage. But the risk of all that together happening is around 1 in 100,000, so very unlikely. There are, of course, some theoretical risks like paralysis and death, incredibly unlikely as well. Side effects, not a lot of side effects with this procedure because we use a small amount of medication, relatively speaking, specifically on the nerve root in question. You're not taking a pill systemically affecting your entire body. That being said, if what you're getting injected is steroid, then you may feel certain kind of side effects like being a bit more stimulated, sleep disturbance, and even irritability. So be mindful of that. Now, there are other things that we can inject besides steroid. We can always go down the regenerative medicine path as well if you're a candidate. And this can include things like PRP or platelet-rich plasma, bone marrow aspirate, which is a combination of a cellular mixture including stem cells, and alpha-2 macroglobulin, which is an enzyme in your body that can turn off the inflammatory cascade and the inflammatory chemical reaction to begin with. Those are all very natural alternatives. They're all typically taken from your own blood system. So that's what we call autologous. Nice and safe, no preservatives, no chance of rejection. If you're interested in something like that, you can talk more to your doctor about that. Or if you're a patient of ours, you can talk to one of our providers as well. If you have any questions, concerns, or comments about an epidural steroid injection, feel free to call us directly. We'll be happy to answer your question, either myself or one of our providers. I hope this video was helpful for you. This is not intended to be medical advice in any way, shape, or form. Again, strictly for educational purposes. Thank you so much for watching, and I hope you have a great day, and I hope you feel better. Here at Remedy Pain Solutions, we are relieving pain and restoring function.